Hey everyone, welcome back to the channel. Today we're talking about something that for many of us is the ultimate symbol of summer watermelon. It's refreshing, it's hydrating, it's packed with vitamins A and C, and it's just delicious. On a hot day, there's almost nothing better than a cool, crisp slice. And for the most part, watermelon is an incredibly healthy and safe choice for just about everyone. It's low in calories and high in water content, making it a fantastic addition to a balanced diet. It's the kind of food we doctors often recommend without a second thought. But, and this is a big but, what happens when you eat it every single day? Can there be too much of a good thing? It turns out, yes. While it's generally a superfood, for some individuals, or when consumed in very large quantities, watermelon can lead to some surprising and even serious side effects. It's important to understand that our bodies are complex, and what works perfectly for one person might cause issues for another. It's all about biochemistry, individual sensitivities, and pre-existing conditions that can change how your body processes this popular fruit. So today, we're going to put watermelon under the microscope. We're going to slice into the science and explore the potential downsides that you probably haven't heard about. We'll be covering 6 serious side effects of eating watermelon daily, from digestive distress to some more unexpected reactions. My goal here isn't to scare you away from this amazing fruit, but to empower you with knowledge. Understanding the full picture helps you make the best, most informed decisions for your health. Let's get into it. Alright, let's start with the most common issue people might face: digestive problems. Watermelon is incredibly high in something called fructose, which is a natural fruit sugar. Now, for most people, fructose is not a problem. Our bodies handle it just fine. But watermelon is also a high FODMAP food. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are short-chain carbohydrates that, for some people, are poorly absorbed in the small intestine. When they aren't absorbed, they travel to the large intestine where they get fermented by gut bacteria, producing gas. This process can lead to some really uncomfortable symptoms. We're talking bloating that makes you feel like you've swallowed a balloon, painful gas, stomach cramps, and even bouts of diarrhea or constipation. If you've ever felt uncomfortably full or gassy after a big watermelon feast, this is likely the reason why. It's especially a problem for individuals who have irritable bowel syndrome, or IBS. Many people with IBS are very sensitive to high FODMAP foods, and watermelon can be a major trigger for a flare-up of their symptoms, turning a pleasant treat into a day of discomfort. Furthermore, there's a condition called fructose malabsorption, or fructose intolerance. This is different from a fructose allergy. It means your digestive system simply lacks the ability to properly absorb fructose. For these individuals, even a moderate amount of watermelon can lead to significant gastrointestinal distress. It's a classic case of dose dependence. One slice might be fine, but making it a daily habit and consuming large portions could mean you're constantly feeding those gas-producing bacteria in your gut, leading to chronic digestive issues that you might not even attribute to your favorite summer fruit. Next up is something that can be far more serious, especially for certain populations: the risk of potassium overload. Now, potassium is an essential mineral. It's vital. It helps regulate fluid balance, nerve signals, and muscle contractions. Your heart, in particular, relies on a very precise balance of potassium to maintain a steady, normal rhythm. Watermelon is a good source of potassium, which is generally a great thing for healthy individuals. A large wedge can contain over 600 milligrams of this important nutrient, helping you meet your daily needs. The danger arises when your body can't effectively get rid of excess potassium. This is a major concern for people with chronic kidney disease, or CKD. Healthy kidneys are pros at filtering waste from your blood, including excess minerals like potassium. But when kidney function is impaired, potassium can build up in the bloodstream to dangerous levels. This condition is called hyperkalemia, and it's a serious medical emergency. High potassium levels can disrupt the electrical signals in your heart, leading to an irregular heartbeat, palpitations, muscle weakness, and in severe cases, it can even cause a heart attack. It's not just people with kidney disease who need to be cautious. Certain medications can also increase your risk of hyperkalemia. These include common blood pressure medications like ACE inhibitors and angiotensin II receptor blockers, or ARBs. These drugs work, in part, by affecting how your kidneys handle potassium. If you're on one of these medications, or if you have a known heart condition like congestive heart failure, a daily watermelon habit could inadvertently push your potassium levels into the danger zone. It's a prime example of why you must consider your entire health profile, including medications, when making dietary choices. Let's talk about sugar. While watermelon is mostly water, its sugar content is not insignificant, and the way our body processes that sugar is key. To understand this, we need to look at the glycemic index, or GI. The glycemic index is a scale from 0 to 100 that ranks foods based on how quickly they cause your blood sugar levels to rise after eating. Foods with a high GI are rapidly digested and absorbed, causing a fast and significant spike in blood sugar. Pure glucose is the benchmark at 100. Watermelon, surprisingly to many, has a high glycemic index, typically ranging from 72 to 80. This means that when you eat it, the natural sugars it contains are released into your bloodstream pretty quickly. For a healthy person with a functioning pancreas, this isn't a huge problem. Your body releases insulin, which helps shuttle that sugar into your cells for energy, and your blood sugar levels return to normal. But the story is very different for someone with insulin resistance or type 2 diabetes. For these individuals, their bodies either don't produce enough insulin or don't use it effectively. Eating a large portion of a high GI food like watermelon can overwhelm their system, leading to a sharp, prolonged spike in blood sugar, a condition known as hyperglycemia. Over time, frequent hyperglycemia can cause serious damage to nerves, blood vessels, and organs. This is why moderation is absolutely critical. While a small, controlled portion can fit into a diabetic-friendly diet, eating watermelon every single day, especially in large quantities, could make blood sugar management incredibly difficult and potentially dangerous. This next one is rare, but it's so serious that we absolutely have to talk about it: a severe allergic reaction. Most people don't think of watermelon as a common allergen like peanuts or shellfish, and it's not. True watermelon allergies are uncommon. However, they do happen, and when they do, they can be life-threatening. The symptoms can range from mild, like hives, itching, or swelling around the mouth, to much more severe reactions. The most severe form of allergic reaction is called anaphylaxis. This is a rapid systemic reaction that can affect your entire body. Symptoms can include difficulty breathing due to swelling of the throat and tongue, a sudden drop in blood pressure leading to dizziness or fainting, rapid heart rate, and gastrointestinal symptoms like vomiting. Anaphylaxis is a medical emergency that requires immediate treatment with an epinephrine autoinjector, or an EpiPen, and a trip to the emergency room. While incredibly rare with watermelon, the possibility exists. Interestingly, some people who experience allergic reactions to watermelon might be experiencing something called oral allergy syndrome, or OAS. This happens in people who are allergic to certain pollens. The proteins in some fruits and vegetables can be so similar to the proteins in pollen that the immune system gets confused and cross-reacts. For watermelon, the cross-reactivity is often linked to allergies to ragweed and certain types of grass pollen. So if you get hay fever from ragweed in the late summer, you might be more susceptible to experiencing an itchy mouth or throat after eating watermelon. Have you ever eaten something and then, an hour or two later, developed a splitting headache? For some people, that trigger could be watermelon. This link comes down to a naturally occurring compound called tyramine. Tyramine is an amino acid that helps regulate blood pressure. It's found in a variety of foods, especially aged, fermented, or cured items like aged cheeses, cured meats, and soy sauce. But it's also present in some fruits and vegetables, including watermelon. For most people, tyramine is harmless. Our bodies have an enzyme called monoamine oxidase, or MAO, that breaks it down. However, some individuals either have lower levels of this enzyme or are taking medications that inhibit it, such as certain types of antidepressants known as MAOIs. When tyramine isn't broken down properly, it can accumulate and cause blood vessels to constrict and then rapidly expand. This change in blood vessel size, especially in the brain, is a known trigger for severe migraine headaches in susceptible people. While the research on watermelon specifically is not as extensive as it is for, say, aged cheese, clinical observation and patient reports have pointed to it as a potential culprit. One study published in the journal Allergic documented cases where patients experienced migraines shortly after consuming watermelon. If you are a migraine sufferer and you've noticed a pattern where your headaches seem to appear after eating watermelon, it might not be a coincidence. Keeping a food diary to track your meals and symptoms can be an incredibly powerful tool to identify your personal triggers, and tyramine-containing foods could be one of them. Our final side effect is probably the most visually striking. but thankfully, the least medically dangerous. Have you ever heard that eating too many carrots can turn your skin orange? Well, a similar thing can happen with watermelon. This phenomenon is due to a powerful antioxidant called lycopene. Lycopene is the pigment that gives red and pink fruits and vegetables, like tomatoes, pink grapefruit, and of course, watermelon, their vibrant color. It's a fantastic compound with numerous health benefits, including reducing the risk of certain cancers and heart disease. Watermelon is one of the richest natural sources of lycopene, even more so than raw tomatoes. When you eat watermelon every single day in very large quantities, you can end up with extremely high levels of lycopene in your bloodstream. Your body will store this excess lycopene in the outer layer of your skin, the stratum corneum. The result is a condition called lycopenemia, which causes a yellowish-orange discoloration of the skin. It's most noticeable on the palms of your hands and the soles of your feet, where the skin is thickest. Now, I want to be very clear. Lycopenemia is completely harmless. It is not dangerous, and it does not cause any other health problems. It's purely a cosmetic issue. The discoloration is not permanent and will fade over a few weeks or months once you reduce your intake of lycopene-rich foods. It's a fascinating, if slightly alarming-looking example of how what we eat can literally show up on our skin. So if you're on a major watermelon kick and your palms start looking a little orange, don't panic. It's likely just the lycopene making its presence known. So, after hearing all that, you might be looking at your next slice of watermelon with a little bit of suspicion. But please don't. My goal today was not to demonize this delicious and nutritious fruit. For the vast majority of people, watermelon is, and remains, a perfectly healthy choice. It's hydrating, full of vitamins, and a wonderful part of a balanced diet. The key takeaway from all of these points is not avoidance, but awareness and moderation. Too much of anything, even something as healthy as watermelon, can lead to unintended consequences. The issues we discussed today, digestive problems, potassium overload, blood sugar spikes, are primarily a concern for specific groups of people or when the fruit is consumed in extreme excess. It's about understanding your own body, your pre-existing conditions, and your personal sensitivities. Listening to your body is one of the most important things you can do for your health. If you feel bloated after eating watermelon, maybe eat a little less next time. If you have a condition like kidney disease or diabetes, you know that you need to be more mindful of your diet in general, and that includes your fruit intake. Ultimately, knowledge is power. Now you're equipped with a more complete understanding of watermelon, both its incredible benefits and its potential risks. If you experience any unusual or concerning symptoms after eating watermelon, or any food for that matter, the best course of action is always to speak with your healthcare provider. They can help you get to the bottom of it and provide personalized advice. So go ahead, enjoy your watermelon this summer. Just do it mindfully. Stay healthy, and I'll see you in the next video.